What's going on, guys? Tony Maritato here in the mirror through the video. Here's the deal. I posted a blog post recently about using a TENS unit. Is it safe after a total knee replacement? I got a ton of questions asking about pad placement. Where do we put the pads when I'm using a TENS unit after a knee replacement? So I figured, let me show you guys a video of where to set up the pads, some common recommendations, and then I'll even show you inside the device some of the settings that I typically recommend. I do everything by feel. So if you notice, here's my knee. Obviously, there's gonna be an incision down the center. Now, most patients are gonna report pain on the inside of the knee. There's a bunch of conditions in which they're gonna experience pain on the outside, but most commonly, the pain, the numbness, the burning, the band that feels like it's wrapping around the top of the shin, bottom of the knee, those are the most common complaints. And I think part of the reason why the discomfort inside here is so common is because once they open the knee up and they displace the patella, the kneecap, there's a lot more, I believe, work that happens coming in from the inside. So anyway, let's get into the TENS unit placement. So I've got a standard TENS unit here, 4 pads. For a knee, I like the 2x2 pads. I think they're like 1.5 inch by 1.5 inch really, but typically we call them 2x2s, they're square. What you'll see is that I've got one wire, one lead hooked up to each of the 2 pads. It doesn't matter black or red, which one goes where. I'm gonna bring this camera down here so you can see my knee. Give me just a second to set up here. Okay, and so what we're gonna do, we're gonna put these pads on. I'm trying to do this one-handed, so apologies for the shaky camera. If I put one kind of inside the calf, we wanna try and find the meaty parts. Even though you might be feeling pain right here locally on the inside of the knee, you wanna go below and then above. And the most common pattern to start with is a crisscross pattern. So if I have one electrode on the bottom inside of the knee, I'm gonna put the other electrode on the top outside of the knee. And so like you can see here, see how that's starting to peel off? No big deal, I'll take it off, I'll turn it around. So the lead wires are coming in this way and coming in this way. And then I'm gonna do the same arrangement, just opposite on the other side. Now, I tend to keep the colors the same in the sense that if I have a black lead wire on top, I'm gonna keep both blacks on top and then both reds at the bottom. Truthfully though, it does not matter. So we're gonna put this down here. A couple guidelines. So outside, right here on the outside of the knee, this bone is the head of the fibula. We don't want to put that pad right on top of that bony structure because the peroneal nerve wraps around there and goes down, gets a little uncomfortable. So I'm just dropping the pad again on the fleshy part, a couple inches below the head of the fibula. I've got a crisscross going, so this wire and this wire are working together. Now let's take a look. I always keep my plastic because this is where the pad's gonna go back. Let's take a look at the settings, and I'm gonna do my best to describe what this feels like. So first, if I open this, it runs off a 9-volt battery. You can see there's pulse width and pulse rate. I typically set the mode to normal. I'm not gonna get into the other settings here. Even though I recommend between 10 and 15 minutes, this one automatically stops at 15. I can turn it to continuous if I want longer, but personally, I prefer having an episode of TENS for 15 minutes on, then 15 minutes off, and then repeat it if I need. So what we're gonna do is we're gonna turn on the device. As I start to turn, you can see the light starts flickering. Now pay attention to the way that's blinking. It's blinking in kind of a slow rate. I don't feel anything yet. The intensity is set very low. But if I start to play around with pulse rate and I turn that to bring it up, see how now that's a solid light? And then as I bring it back down, it starts to blink. That's what I like personally. I like something that is kind of a a vibrating sensation. Now, right now, it's hard for you to see, but on the front, there's a little indicator. So right now it's set to number 2. As I turn it, I still don't feel anything. We're getting to number 3. I just now start to feel a little bit of a buzz. As I go between 3 and 4, right now that's a perfect level of sensation for me at this point. I feel it buzzing, it's comfortable, there's no muscle contraction, it's literally just a little vibration. And then if I go to the other one, I do the same thing. I start to turn it. Now this one I can actually start to feel at 3. So the dial here is set to 3.5, the dial here is 3, but that's fine. It's about sensation. Now the other knob that you can control is the pulse width. And so as I start to turn that up, what happens is the vibration sensation starts to change. And typically for me, what I believe to me feels most comfortable is 180 for a pulse width and close to 70 for a pulse rate. That's perfect. Like that now is sitting comfortable. You can see there's no muscle contraction going on. Everything is relaxed. It's just a normal vibrating sensation. So I'm gonna sit here. Let me see if I can move this over. I'm gonna sit here. The TENS unit is on. The leg is propped. I can do my terminal knee extensions from here. I can do a little active contract relax from here. I can put a weight on top of that if I want to try and get more extension. I can use a strap. Actually, I'll do another video to show you how to work the strap if you want to do the strap for knee extension. There's just a bunch of stuff you can do. But the main thing is that the knee is comfortable, and you know, the TENS unit is not doing anything to heal the tissue. It's simply distracting the brain. It's giving my brain, my nervous system, something else to feel that's different from the pain sensation that I've been feeling. So guys, if you have questions, let me know. My typical recommendation, but you always have to talk to your doctor. You have to make sure that you're allowed to use a TENS unit. Make sure you don't have a pacemaker or other contraindications for using a TENS unit. Assuming you're cleared to do it, then typically I like 10 minutes, 15 minutes at the most, then I turn it off. I can leave the pads where they are. 15 minutes later, do another cycle. You can put ice on top of it. You can put moist heat on top of it. You can do whatever you do to feel better during, before, or after your exercise program. Guys, if you have questions, please don't hesitate to ask. Post them in the comments below. I always look at all the questions, even if I don't have time to answer them all. I'm a therapist. I'm still here in the clinic. I've got patients getting ready to walk in the door. So I'm available to help as much as possible, but I'll catch you on the next video.